Hello, good evening, everyone. Welcome. Thank you guys so much for joining us. Really appreciate y'all taking the time out on this Thursday evening to be with us for a really awesome conversation and another session in our Fair Fight Together series. And just like we do every time, if you're new, we always ask people to put where they're from in the chat. So if you wouldn't mind doing that, just so we can see who from all across the country is here with us this evening. And I also just want to note there should be a live transcript function for people if you find that useful. So if you have any questions or issues with that, drop it in the chat. And just for people who don't know or haven't been here before with us, Fair Fight Together is a series where we at Fair Fight are hosting different kinds of conversations with experts in the fight for democracy. And it's a great opportunity for our community to come together, to learn, to grow, and to feel inspired. And so before we get started, some quick intros. My name is Nicole Robinson. I'm the Deputy Executive Director here at Fair Fight. And I am delighted to be joined by two excellent advocates and community leaders and organizers, Cokley and Dom Kelly, for an insightful conversation on healthcare and what it means for our democracy. Thanks everybody for dropping where you're from in the chat. I see we have folks from all over the place, the South, Midwest, North, West Coast. So really excited to have so many people here with us. And so we have a lot to talk about. And just quickly, Patrick is the Senior Program Officer for Equity and Social Justice Partnerships at the Robert Wood Johnson Foundation. And Dom Kelly is the founder, president, and CEO of New Disabled South and New Disabled South Rising. And again, we're so grateful for y'all for joining us and for the incredible work that y'all do. And we have a lot to discuss. We're going to go ahead and jump right in. So this first question is going to start out a little heavy for folks. But just to get us kicked off and level set, we're starting off a little heavy here, but it's hard to believe that in the United States in 2025 we're witnessing ideological attacks on science and facts. We're seeing our world-renowned medical research infrastructure being disassembled. Millions of Americans are facing the threat of loss of healthcare. The current administration or regime, which I think is a better way to put it, is really walking back on positive advancements, trying to address like racial disparities in healthcare. And so we're living through that. We're living through the MAGA agenda, the Make America Healthy Again agenda, which are none of those things. And so my first question that I want to direct to you, Dom, is how do cuts to healthcare access weaken not only healthcare outcomes, but also democratic participation and civic stability?
Sure. Well, first of all, thanks, Nicole, and thanks for having me. Dom Kelly, just a visual description for anyone who's blind or low vision, white guy with blue collared shirt, glasses, brown hair, and facial hair in front of a not so great painting. I'm in a hotel room. Wouldn't be my first choice. So thank you for this question. I think it is, it's, I think, safe to say that there is a there's a direct link, an inextricable link between healthcare access and democracy. Um, in fact, in 2022, the American Medical Association passed a resolution to determine that voting was actually a social determinant of health. Um, and I think that's really important to note because when we talk about voter suppression, and of course the work that y'all do at Fair Fight, which I used to work at Fair Fight and just have a deep passion for access to voting. Voter suppression uh, often happens and shows up in communities that are already marginalized, that are already facing the inability to access all sorts of things like healthcare, places where there are hospital closures, in majority minority counties and cities, right? So when you add in the inability for people to actually receive care that they need, and we should know it shouldn't have to be said, but should note that like healthcare is something that we all need. Everybody needs it at some point or another. Preventative healthcare in response to emergencies or chronic illnesses, So healthcare access is a must, and there is data to show that things like hospital closures actually reduce voter turnout. So, and we're just talking about elections. So when when there are areas like in different counties in the state of Georgia that have closed hospitals, especially rural areas, voter turnout in those areas actually decreases, especially if those hospitals close within a certain number of months ahead of a specific election. And those are typically going to impact adults and lower income residents. Um, and so like just voting alone, there is a direct link between people's ability to access any kind of healthcare that they need, especially hospital care, and their ability to go and vote. There's also just typically the inability to actually be a part of any sort of civic engagement, and that's just volunteering. That's being a part of like having group memberships to community organizations. All of those kinds of things that increase someone's civic engagement are directly tied to not just their ability to access healthcare, but their own health. And so when we are living in a country now where a trust in public health is being eroded every day, where cuts, and I know we'll talk about the big beautiful bill, but cuts to things like Medicaid and SNAP will directly impact people's day-to-day health. And then we are taking away funding from all of the things that actually improve the other social determinants of health. We're going to see less, healthy people. We're going to see more people who are not getting their needs met. And we're just going to see less participation overall. And part of that is because when we go door knocking at people's, every election cycle, when we go door knocking, we've heard from organizers election after election, especially since 2020, that there's not really apathy around voting. A lot of times people just want to get their needs met and they're trying to put food on their table or keep a roof over their heads. Like, so another thing that makes it that much more likely that someone is not going to vote, someone is not going to participate in civic life. So it's an inextricable link, but between those.
Yeah, thank you so much, Dom. I think one of the things you said really like stuck with me is like voting is a determinant of health, and that is very true. And I think a lot of people don't always think about how every single right, anything you care about, any issue you care about, is so intertwined with how free or fair are our elections. And with that, like I would actually really love to get into and sorry y'all for my language, but I'm gonna call it what it is, the big bullshit bill. Um, but I want to go there and talk about that a little bit. And I'd like Patrick, if you could start with an answer to this one, and then Dom, obviously, please feel free to jump in. But really, if you could break it down for us, 'cause I know people talk about the big bullshit bill of like it's a budget bill, it's an economic bill, which of course, but it also will have a huge impact on healthcare and the American healthcare system, and in that, our democracy and our ability to have free and fair elections. And so, Patrick, if you could just talk to us a little bit about what that bill means for the American healthcare system.
Sure, of course, and thank you so much for having me. I'm Patrick Cokley. I mentioned in my day job, I work for the Robert Wood Johnson Foundation. I'm a light-skinned black man with wearing dark glasses. My locks are pulled behind my head. I don't know if they'll make an appearance. They may. I am sitting in front of my wife's prodigious collection of Lego with our ubiquitous "Keep Calm and Lead On" sign over my right shoulder. So the big beautiful bill. This is in essence is couched as legislation, right? Cuts more than $1 trillion from essential health programs like Medicaid and SNAP, which means millions of hardworking people are going to lose health care coverage and also lose things like food assistance. it's largely going to be carried out through red tape and difficulty in accessing care. And I think Dom hit on something very crucial when he was even talking about voting. We talk about the communities in the United States, especially those of us that are either living with housing instability or managing disabilities or managing many of the myriad other things of life. It's really easy to separate us from our civil rights, from our opportunities to make our communities better by making it difficult to access these things. Even with voting, you can draw a line around a voting place, and in a mile, everybody will be able to vote. The moment you get outside that circle, it gets more and more difficult. So what's going to happen is with this bill, seniors will struggle to afford long-term care. People with disabilities will lose critical health care coverage because they will have difficulty either compiling the forms, jumping through the hoops that have been made by it. And when that happens, we not only lose the access to this care and these resources, we lose these members of our community because then they won't be living independently, which means they won't be managing their careers, their jobs, and families and bolstering their communities, even with that income that they had before. And it's even going to be more difficult, I think, in a lot of rural spaces because when you start pulling those strings with healthcare, you start losing hospitals. And then suddenly you live in a rural county where there's not a hospital for 50 miles. And then, that has all sorts of dangers. People will lose their lives. So it's a lot scary. I think we're right to be ringing all the bells because there's a lot of damage here that can be affected to people, and that's why we're ultimately scared and worried, and why there needs to be a response. The dangers of these cuts is something that I think we haven't seen. It's going to be a generational hurdle that we're going to have to figure out a way to jump over.
And if you have anything you wanna add or touch on.
I mean, I think Patrick said it all. The one thing I would add is uh, I've heard, Patrick, you didn't say this, of course. I've heard a lot of people say, well, the people who need Medicaid the most are not going to be impacted by these cuts, like disabled people, right? Children. And one, that's false. But two, it says so much about how our society views disability, how it understands one's ability to work or not work. And so with the now added and tightening of work requirements in order to get Medicaid benefits and SNAP, that leaves out an enormous population of people who should receive Medicaid, but because they can't meet these certain requirements, won't. And so what we went from wanting to get states to expand Medicaid, states like Georgia and others, particularly in the South, to now we're just talking about how do we make sure that the people who really need it can get it. And that's why we're going to see this enormous number of people who are losing access to Medicaid over the next decade. But just to be like very clear that this is not a case where the people who need it most are still going to be able to get it. There are people who need it most who are going to lose it, and it's going to be very hard for them to get it.
Yeah, it's funny too, Down, because I think what bugs me the most too is this misconception, especially when we're talking about Medicaid, and talking about SNAP, and even when we're talking about disability, as if this is some far away group of people that we've never met before or live in this tiny community that we could somehow overlook, as opposed to a community that is part of our families, part of our communities, and especially when we talk about young people of color, immigrant communities, they're going to face large impacts from all of this. But there's this almost sort of like idea that we can pretend that it's only going to happen to a small group, and that ignores the fact also that the communities that it's going to impact will ultimately impact everyone through one form or another. They're going to be members of our family, they're going to be members of our community, and then at times it's going to be us. If you're not considering yourself a person with disability, then just wait, because it's going to happen eventually, and that's going to have an impact on you. And it's so that I don't want to say it's being a person who's low vision. I hate to say it's short-sighted, but it's so not paying attention to the needs that our country is going to have in its future by cutting off the ability for us to have these supports and for us to thrive.
Yeah, that appreciate you guys for highlighting some of those pieces. And one thing that I think really strikes me about it, and I appreciate you making the point of like, people like to think about this stuff as if it's like so far away and you're so removed from it because you're like, oh, I don't need that. That won't affect me. But to the point of like, well, I think it's pretty clear how like lack of access to healthcare impacts voting in our democracy, right? So if we don't have all the people who can participate, we're not going to have a representative democracy. We already don't, right? So that those types of things are just going to get worse when hospitals close. I think it was mentioned, Dom, in the beginning. I think Georgia's had 12 or 13 hospitals close since 2013, nine in rural areas. That has an economic impact, of course. And so these things they do affect all of us. And I hope people can think about it that way. And to that point too, on the way that these policies will impact everybody, but will have a disproportionate impact on people from historically marginalized communities, just like everything always does. Could y'all, and I think I can start with Patrick on this one, if you are okay with that, kind of talk a little bit about like healthcare equity and from the vantage point of we were making strides in this country in having research that was informed by the fact that there are racial disparities in healthcare and trying to resolve those and fix those. So if you could talk a little bit about what does healthcare equity look like? And then also, what are you seeing happen to our ability to ever have equity in the healthcare system?
Yeah. I think it's funny because we talk about healthcare care equity. And again, it's something that's actually conceptually, I think a lot of Americans are aware of and have an understanding of, but I'm not sure they believe that it's actually possible for them to access it. For me, healthcare equity really means working towards a healthcare system that's accessible, affordable, treats everyone with dignity and respect. And it's like that seems a little pithy, but it means all of the things that we really want to get when we find ourselves in need of care, not struggling or fighting with with our managed care organization or worried about our insurance, but knowing that we can get access to what we need. It's a system that recognizes that there are past harms that members of our society have like been a part of or encountered when they've been attempted to get care. It means a system that's flexible enough to recognize ableism, sexism, racism, and homophobia aren't just like hypotheticals or just like, again, like, oh, I heard that there's this thing about accessibility. Maybe we should get on top of that. But rather understand there's real impacts to how folks who manage those identities have access to the care that they need. But it also means creating a system that considers all of these things that affect your health. That also may not come from a doctor's office and understands things like the social determinants of health, where you live, where you work, where you play, where you worship, where you go to school, might have an impact on your health outcomes or that your access to the tools and resources. And again, a lot of these policies that we have seen coming out try to ignore or pretend that those are not instances, which would allow you to, again, to close a hospital in a rural space and say, oh, it's fine if you drive 50 miles to get to care. I think it's also too where we can get a little futurist, a little sci-fi if we want, and say that it's a place where health isn't just a privilege for the wealthy or for a moral few, but a place where we also as Americans can devote our resources, our energy, our time, and our efforts into believing that everyone should have a chance to live for their fullest health. That's where I go when I think of healthcare equity. However, that is something that we're aspiring to. And so how we get there means also attempting to put either policies or in many cases you mentioned data, gathering the data that will help us really be able to say, are we headed in that right direction? Are these policies doing what they should be, what we want them to be? And are there people that we have consistently left behind or that are not really benefiting from this in the way that we wish to? For data, for being able to prove it, I used to work with a research director when I worked for the federal government who said that if I don't have data, then I can't prove that we did what we were trying to do. And so that's the other reason why the attacks on data, especially, I find really concerning because they're not only just a way to prove, that the ideas, the theories, the hypotheses that we have are working. It also then it can be a point to push us in the right direction and say, hey, let's put our effort into this versus hey, leaving other things out or really like going in a way that says, well, this feels right. I don't care if it leaves behind Black, Latino, and Indigenous people. We're going to keep doing it instead.
I appreciate that. And Patrick, you saying that we can get a little sci-fi with our vision with this makes me think about a quote that I really, really love. I believe that all organizing is science fiction, that we're shaping the future we long for and have not yet experienced. I'll drop that in a chat in a second for people to have it, 'cause I love it. And so to that point, Dom, if you could talk a little bit about on the healthcare equity piece, like if you have your sci-fi vision, and I will say these things are all doable, they are all possible, kind of like what does that look like for you?
Yeah, that's a great question. I think, um, I mean, I think a lot about the kind of world uh, that I want us to build, and I go back a lot to like early COVID-19 pandemic when there was this very brief, unfortunately, moment where um, not enough was known about what was happening with COVID. Um, and I would say probably at large, the majority of people for a moment were able to sort of like come together and care for each other. And we lost that because of rampant mis and disinformation, because of conspiracy theories and political agendas. But for a brief moment, we celebrated the healthcare workers who showed up. We celebrated the people who went to hard to reach communities to set up testing sites. We celebrated the people who went to rural areas and set up mobile clinics to help people who had COVID be able to get the treatments that they needed, even if they were far from hospitals or were one of the 9 counties in Georgia that didn't have they don't have a single doctor in it. So for a very brief moment, it seemed like the majority, or at least it felt like the majority of our country, were at least on the same page that we had this what felt like a very acute, emergency situation that we needed to figure out together how to do that, like flatten the curve thing. And so, like in my vision, in my world, in my sci-fi world, we would live in a society where people got their needs met, regardless of where they lived, and that we all helped each other. And it wasn't just because there was, a global pandemic, that we had mobile health clinics and we had community health centers everywhere where they're needed, and made sure that people could get access to vaccines and could get access to treatments. That if they didn't have a vehicle or public or some form of public transportation, that we could figure out a system of care where people could get to where they need to go. That your ability to actually get healthcare isn't connected to your employment status. Like those are the kinds of things in my sci-fi world that I think are actually not that hard to do because we've literally done it before, and it's the political will, unfortunately, to do it. The people in power would rather keep people poor and sick. Than they would to give communities the things that they needed to thrive. We're arguably the richest country in the world, and yet we continue to defund healthcare and defund schools and all of the things that are a part of the social determinants of health. We year after year or election cycle after election cycle just continue to take money away from, and we put it into things that ruin our environment and destroy global economies and destroy humans and land and other places. And so yeah, I think we achieve health equity when we invest in people and communities, and there's a way to do it. Other countries have done it. I don't know that anywhere has achieved health equity, and many places have their issues. And I use this as just one example, knowing that this place has many issues. But I was in Rwanda in June, and they have a lot of issues, including a quasi dictator. But they have improved health equity and health outcomes in particularly rural communities in the northern part of Rwanda um, in the last 20 years by doing so many things that are that seem so basic and yet have an impact. And part of that was like literally just having systems for community health workers to really be deep in these rural communities, and they're not just helping people get their medical needs met, they're also educating people, they're bringing community members together, right? Like, so it's not perfect, but lots of other places have figured out some answers. And again, we sort of did for a minute, and I think and I know we can do it. It just takes the political will.
Yeah. Also, if I may, I also want to sort of take a moment and remind us that it is okay to be sort of ringing the panic bell or like waving the flags for this, because we've seen what oppressive policies do to communities. When Dom, you mentioned like the start of COVID, there was all the talk all of a sudden, everyone I sort of felt like the mainstream community suddenly discovered something the Black community talked about a lot, the Tuskegee experiments, and how trust in the medical field had been eroded by this community and by those actions. And that's one of the most dangerous things that comes of all of this, that we lose trust in the medical community and people that have been set up to provide healing and care, especially at times when we need it. But the oppressive policies like that have given us the greatest hits of redlining, ugly laws, Asian internment, the Trail of Tears, like all those great things, the Tuskegee experiments. And so, we're seeing, warning flags that say, hey, we're headed back to those places. It's totally right for us to be like, no, we shouldn't do this. We should not do this at all. And the other thing that's interesting about it is that these policies and these practices tend to be a bit of a harbinger. They're like a pilot fish because they then lead to, when you don't have good access to healthcare, you then also tend to have difficulty making it to your job, like staying employed. You then have difficulty like managing home ownership. The path to wealth shrinks when you don't have good health. The ability to maintain your family, it again gets difficult. So it's really the right thing to do right now to be like, hey, we don't want to go back down this road. This is a time to call it out. And I think that there is sort of a subtext that suggests that maybe we're hair pulling, or maybe it's not as big of a deal, that there's a gentleman's agreement will take care of it. No, this is the time. I want to recognize this is a time. We should be concerned. We should be yelling about these things. We don't want to go back down that road that we've been down before, that our communities, that multiple communities have known about. It's not hypothetical. This is what will happen if we're not able to stop some of these drastic changes to our healthcare policies.
Yeah, completely. And I want to go back to something that you just mentioned, Patrick, about losing trust in the healthcare system and the harms that that causes for people, and how like we've seen it before. And to your point too, Dom, when you mentioned um like back when COVID was happening and like people were cheering healthcare workers and like people would bang pots and pans out of their windows in the evening. I completely forgot that happened. And it really wasn't that long ago. It just feels like it was a really long time ago, and where we are now with kind of, it almost seems like that, how are we in a world where that was ever what was happening, where that ever did happen? But that's part of the authoritarian playbook, right? Like you take away people's ability to trust systems, to trust institutions, and then from there it makes it really easy to take away their rights, right? Like the healthcare is a right. Healthcare is something that everybody should have access to. But if you make people lose trust in our healthcare institutions, the healthcare system, like I said, it's easy to take that away for people. And it makes me think a lot about like vaccines and the mis and disinformation related to vaccines. The fact that the Trump regime and his allies have for years, and others before them, made it a point to attack experts in the world of vaccines and the healthcare field that recommend vaccines. And now we are seeing new outbreaks of diseases like measles and things that just didn't be happening. And so a question that I have, and whoever would like to answer this one first, is kind of like, how do you encourage, or would you encourage people to fight back against these types of things, these attacks on the institutions, the attacks on vaccines, which we know save lives, especially for people who are immunocompromised? So yeah, for whoever wants to answer that one.
Happy to start. I think that we first fight back by saying the truth. There are a lot of lies, and our former colleague also would say like don't amplify the disinformation. So like we don't need to be repeating the lies. And I think about that all the time, because that's what happens, right? Online, like people will quote tweet or whatever it's called now. It's not a tweet.
Mhm.
They'll quote tweet it and they'll spread it inadvertently, but the best way is to just tell the truth. And there are flat out lies. I mean, I'll tell you, I'm doing a doctorate in public health, and I was in a room today with a bunch of public health folks, and a member of the Trump administration spoke to us, and you could see everyone was just like chomping at the bit to like say something, and I asked her this question, like I called out her racist ableist boss who leads HHS, and I said, how do we like how do we build trust back in public health? And in her answer, she said multiple lies. She said that disabled people aren't going to be affected by cuts to Medicaid, and she said that thimerosal is in the MMR vaccine. And we're talking about a physician, a doctor, a family medicine doctor, um, and and like refutable uh statements, like and we were able to say that's not true, like, and that's what we have to do. We have to just say the facts. We have to tell people the truth. And I'll just share like a personal story. My daughter is two, and she got measles earlier this year, and she had her first vaccine when she was, I think, a year old, whenever you get the first shot. And she was too young for the second. And despite the fact that, we all mask still, she wears a mask. We had to bring her to urgent care for a fall, and she picked it up. And it was awful. It was terrifying. And the fact that we're even talking about measles in 2025 is a nightmare. But what I think was worse than that was when certain people in my life found out, the the rhetoric that they responded with was so like provably false, and I don't blame them, because they are being fed um, algorithms on social media of information that are lies, blatant lies. RFK Jr. knows it's a lie. This woman today knew it was a lie, right? Like there are blatant lies that people are being told, but when we don't refute those with facts, those lies spread. And there are lots of people out there who believe that when RFK says that vaccines cause autism, and that he has a registry of autistic people, and by September, which is coming up very soon, I'll be interested to see what he comes up with. He's gonna know the cause of autism. It's like people believe that stuff. And so like there's so many ways we need to be fighting back right now, but we actually can fight back with information, and we don't need to be academic about it. We don't, our language can be plain, it can be direct. We can help people understand things that might be difficult. Like I don't need to talk about thimerosal and vaccines, but I can talk about the safety of vaccines and the history of safety of vaccines, and why the MMR vaccine is effective, and things like that. So I think that that's just one way, is like if we arm ourselves with information, and we use the information responsibly, then I think we can start to push back against this really harmful stuff that is not just eroding trust in our institutions, but it's also eroding trust in each other.
Yeah.
And that I think is when we are really, really, down the creek without a paddle.
Indeed, I mean, and you're right. It's more than just sort of saying, "Hey, we need a healthcare system that everyone can just sort of go in blankly." But also, I think there needs to be another conversation that we also have about what we expect from healthcare, and how we expect to how that relationship, how we want to have that as part of our lives. I think a lot of us have healthcare professionals in our lives who are wonderful, caring, giving people who we've had good experiences with, but it's when you start talking about the engagement of the systems that sort of make up the medical industrial complex, where it gets a little difficult. But before I joined the foundation, and I took some time to actually worked in a managed care organization because I wanted to learn how they saw disability, and what the sort of what the implications were, like what they really thought about it. And it was scary. It was right at the beginning of the COVID outbreak. I had a front row seat for not only how like COVID was affecting my community in DC, but also like how the companies were responding to it. And people feel like there are large structures and large systems at play that they can't connect with. People feel that there are folks who are more concerned about money being made than their personal health care. And I think as citizens, we have to really like put some, we have to really start redefining what we expect from those places. And it's not going to be an easy push because we're talking about some very large corporations and very large sort of political folks that are benefiting. That lack of trust, like we said, we talked about Tuskegee. Like that didn't happen just out of nowhere. And it didn't happen just in the short period of the Tuskegee experiments, too. We now have multiple generations that don't have trust for the medical community. So we really have to do a lot of work to rebuild that, and really make sure that we're all taking seriously that things like social determinants of health, things like our zip code can have a huge impact on, how healthy we are and our access to care.
I really appreciate Patrick, you saying that the point of the lack of trust that some people have in the healthcare system is valid, right? Like there are people who have experienced really horrible things in the healthcare system. When you know about the Tuskegee experiments and other things, when you know about how doctors experimented on enslaved Black women to come
Mhm.
up with all these kinds of advances, not just Black women, but also enslaved Black men, it knowing those types of things does kind of give you a mistrust, whether it's, should be there or not, or whether that mistrust causes you harm or not. And but the piece of that, and I think something that we've been seeing in this current administration, and it's not like it's anything new, but now the microphone is coming from the White House, right? It's coming from these institutions that have been working to build trust within communities, and all of this really is, and I said it once and I'll say it again, like it is a part of the authoritarian playbook, right? Like you control key institutions, you politicize these institutions, you create chaos, you create confusion, you further drive a wedge in the distrust people maybe already have, or you create it in some people. And so, one thing though about this too is that authoritarian regimes, we've seen them all across the world, all throughout history. Nothing we're seeing now is new, which I hope gives people some hope in the sense of like, when you know what you're up against, it makes it easier to fight it and combat it. So I'm curious, for y'all, and I'll start with Patrick, if that's all right. Kind of like, what lessons do you think we can learn from other countries where authoritarian regimes have undermined our scientific institutions and our healthcare infrastructure?
Well, this is a great question, and I wish I had a little bit more insight on other countries. But what I will say is, I think we should look to our own history. This is not something that we haven't seen before. Let's look at the disability community, specifically, and I want to say 1927, the Supreme Court has the Buck v. Bell decision that basically says that it's okay under careful state safeguards for mandatory sterilization to take place of certain mental defectives. And that opens the door to sterilization being used, on Americans, especially women of color, but largely on men and women with disabilities from that period. It's never been overturned. Now, the reason why I bring that up is not to bum us out, but a reminder that we've had a disability movement that has been working against this since that period. Because the way it worked was that if you were institutionalized, you were likely to be sterilized. If you went in for substance abuse, especially as a woman of color, you were likely to be sterilized. And so We have that in our own country. Now, the playbook, what's been working has been building knowledge about these practices, really attempting to demystify how disability especially has been viewed, though we still have a knee jerk in our country where folks will go right back to the Victorian period and say, well, isn't there a place we can send them? Even though we know that getting care in your own home is normally the best way and best approach. We need to demystify the practices that have been working well, especially for communities that have the least in our country. And then we also need to dismantle this idea that seems to exist for a lot of Americans that says, well, I know we said that's the sort of care or that's the sort of action we would take with this one other group, but that would never happen to me. We have to start addressing healthcare as if it's our own personal health and the health of our families. And a lot of the folks that are attempting to sell, us that authoritarian like perspective are always start saying, well, that's not going to happen to you, that's going to happen to other people. And we have to really press that, like, what happens to the least of us happens to all of us.
Yeah, I mean, like 100%. I also wish I could speak more to other countries. The couple that I did think about, even just going back to Nazi Germany, some of the ways that the Holocaust started was by undermining and delegitimizing universities, science, delegitimizing data. And then if we're talking about communities, very early on, the Nazi Party really wrote the playbook for eugenics movement. Well, actually, they sort of were in tandem, but they basically took disabled people and euthanized them in their terms to manufacture consent to say this is actually a kindness that we're doing to end the suffering that these poor people have to go through, right? And like it's horrifying to think about, but while we may not exactly be at that point yet, it was many, many years of making people see others as the other, making people see people who need benefits, people who need a certain level of care that, the majority of the population might not need, that those people are drains on society or they're taking, money away that could be used for this or that instead. And so that manufactured consent to be able to do those types of things, and that's what we're seeing right now in this country. It's what we saw at the height of eugenics in the US. It's why we had ugly laws. It's why we had institutions like Willowbrook who, got to have disabled people, put children at that, like kept locked in horrible, horrible conditions until a journalist was able to get in and show, the truth of what was happening, because there was just a lack of care for other people and a direct effort to not only dehumanize other people, but to make people not believe what they could see with their own eyes, what they could read in textbooks, what they could read in research reports and data reports. So those are the kinds of things that I think are happening right now to healthcare, are happening right now to with different communities, immigrant communities, queer and trans communities, disabled people. It's making people the other, and then taking knowledge and information away from people so that they believe your narrative. And that's how this starts. And it is, like you said, this is not new. This has happened elsewhere. I remember when COVID-19 happened, when it started, Bolsonaro was in power in Brazil. And I think Brazil at the time had one of the highest rates of COVID in the entire world, and people were dying, disabled people, aging people were dying, and Bolsonaro would say, "Don't believe what you are reading. This is like just a cough or just the flu or whatever, right?" And that was the kind of the way that he could undermine science and public health, and then kind of like hollow out some of those health institutions. And thankfully we don't have Bolsonaro anymore at the moment, but like, that's how this starts. And we're in it. We're already in it. It's not just starting. We are already in it right now.
And Dom, it's funny you mentioned Willowbrook, which is one of the notorious institutions in New Jersey. A lot of those institutional models were built at the same time as models tied around prison. And even when the institutions where people with disabilities were ultimately incarcerated were closed, a lot of folks moved from the institution to a prison sort of complex. That's another reason why we should be concerned about the new growth and development of all these incarceral places and institutions, because once you start building that sort of, if you call technology, if you will, or let's even say this, one of the things my daddy used to say, what is when you're a hammer, everything is a nail. If we build all these, if we support our tax dollars going to building all these institutional places and carceral settings, then suddenly that's going to be the solution for everything. And it's more likely that our Black, brown, disabled, indigenous populations, our poor populations, our immigrant populations are going to find themselves on the business end of that new technology. So it's definitely another yellow flag, if not a red flag, that says, hey, we need to be careful with that, because we know that you're going to start using that as the resource or the solution to every other thing that comes up.
Yeah, I think one thing that like really sticks out to me about that is the point on looking at our own history and seeing how things are normalized, right? Like, and
Mhm.
if you normalize harmful things, it really can snowball, and that's applicable to so many other avenues, and ways in life. And for instance, like if you think about, I think about the parallels to like the civil rights movement and how, like even when we're sort of looking at our own history, that the Voting Rights Act and the Civil Rights Act were not things that like happened overnight, right? Like it was had those getting those successes was a part of like decades long of like advocacy, fighting, litigation, losing in court, people dying, people going to jail to finally be able to somewhat undo some of the normalizing that this society had created of like dehumanizing Black people, dehumanizing members of the LGBTQ plus community. And same goes for people who have disabilities, right? Like it really is and has been about all these efforts to kind of like change hearts and minds in a lot of ways. It makes me think too about like the fight for marriage equality and how not that long ago it was like a normal thing for people to not believe you should be able to marry who you love, right? And it really was. It was like changing people's hearts and minds. And I think that really parallels a lot to what you guys mentioned about the disability community and then with healthcare too. And I hope that gives people some sort of like hope and perspective of like all these successes that we have had that we are seeing being eroded or like hard fought. And if you think about the times of people in the disability rights community, the the people fighting against voter suppression, Jim Crow, there might have been like one step forward and like 20 steps back. And I'd say maybe like that's where we are right now in the sense of things. And so I want to kind of like maybe pivot to something a little brighter. I think we're like kind of getting a little happier here. And so one thing I'm curious about is for y'all as folks who are experts in healthcare equity and combating disparities in the healthcare field and are very passionate about it as well, kind of what are some areas or actions that inspire you, whether it's things you've done, things you see other people do, like what can people like think about and hold on to and have more hope?
I have one. It's a little silly, but since we already talked about sci-fi, which is another one of my favorite things, let's talk about comics for a hot second. One of my favorite things, one of the things that's actually being a bit of a bright spot is X-Men 97. And I don't know how nerdy everyone is here, but I guess that was almost I feel so long ago. It's almost a year ago now that they re-released basically a follow-up to the original X-Men that came out in the 90s, sort of reference to Claremont. I'll try not to get too nerdy. But what's cool about X-Men is that it is a diverse group of heroes in a very diverse world struggling against very complicated things. And it's super popular and engaging. People care about it. They see themselves in each of the characters. They find something. It's not always great, but it's not always bad anyway. And that tells me that we as a society still have a desire to understand and address complex and complicated things. That everything that's happening right now is not beyond us. That we are still cultivating people who do have the romantic belief that we can make our world better, but yet also understand that it's not just going to like roll in on the wheels of inevitability. It's going to take a lot of hard work. And some of the conflicts may come from inside the house as well as outside the house. And it seems weird, but it's like, yes, that means that like we are on the same page together. This is possible. It's not just like, if we were watching just sort of the same old thing, it's not Pollyanna-ish. We actually have the capacity to do the work to make our country like better, you know.
Mm. Yeah, I totally agree. I won't I can't get that nerdy. I need to come over and hang out and like get a nerd download.
You're always welcome. Bring the baby.
But I will say like my own nerdy, I've seen more art in just even the last 8 months of the year than I have in a while. Even like so many people I know who are down and scared and feeling the impacts of all of this are creating really beautiful things and using art. Like I'm a fan of I'm a big folky. I'm also a big punk rock fan, and both of those uh, like genres of music are just rooted in activism, in like anti-fascism, in fighting the bourgeoisie, and like that is um, for a while I was like, are we losing that? And it's here. Like I have consumed so much great art in the last 8 months. So I feel really hopeful when I see how artists are showing up and creating right now. I feel really hopeful, and like sort of to address a question that's in the Q&A, in a roundabout way, sort of. I feel hopeful when I see people who um, continue to act on right information, even when the people who are supposed to have the right information and give the right information do not. And so people who understand what community care means, and that we can protect the most vulnerable people in our community, during by doing simple things like wearing a mask, and figuring out how to clean the air, and bringing food to people, right? And that actually like leads to the big one that I really wanted to uplift, which is that like people are building shit. People are like people are building things right now that I think can last, 2, 3, 4, 5 generations into the future. And if we still have a planet, that like the Trump administration and this like fascist, ultra far right Christian, ideology and dogma will not. Like we're building systems of care where people are giving care to each other in their own communities outside of the systems that fail to deliver care to people who need it. Like we're building care webs and mutual aid networks, and like those are the kinds of things that I think like give me hope that like we actually made all of this stuff up ourselves. So like, who's to say we can't make something new? Even when people want to, even when people fight it, even when they don't want us to, people still figure out how to do that. And that to me is, I hate the word resilience because no one should have to be resilient, and it's usually used when we talk about people who are like forced to be in a position where they have to be resilient. But I think it just shows that we as people actually have way more power than we sometimes believe. But they know that we have that power. They don't want us to utilize it, but they know we have it, and we can utilize it by building some really cool shit. And that's what I'm seeing starting to happen, and that gives me a lot of hope.
Yeah. Ooh, and I wanna jump in just quickly even to that end and say something quickly about Gen Alpha and like all the weird like generational names. um they are not sleeping, they are out there, like they care about their communities. And this, I think that's actually one of the most exciting things about like all the younger generations that no one talks about, which is how much they care about their community. There's this running idea that they just want to be on TikTok and make videos, but actually no, they are attempting to change their communities. I used to work for this organization called Civic Influencers that sought to work with young people to teach them how to vote and to engage. And it was never like, oh, I don't care. It was story after story about how either my Nana did this or I live in this community and I want to make it better. And we really have an opportunity to take advantage of Gen Alpha or Gen Zeta or like, and really make sure that they are not only along for this ride that we're of change we're trying to make, but that we also are giving them the tools to lead it. Because the potential, like Dom is saying, is there. We don't have to do this all by ourselves.
Yeah, it's giving like the youth are our future. Like oh, in like the most real way, right? Like our parents, their parents said that about us. So it's like I appreciate you guys saying that because it's like an interesting way I think to think about it. And I know we're running out of time, and this has been such an incredible conversation. And I really feel like the whole theme of this has almost been like Fair Fight Together sci-fi edition, right? Like we can address all the things coming at us if we continue to think outside the box, be innovative, use our power so that we can continue to push towards healthcare equity and accessibility, free and fair elections, like all the things that we care about, we can create. All the things that we have now, the things that we've accomplished, they were just like basically science fiction at the time they were dreamed up and being pushed towards. And so I really appreciate you both, Dom and Patrick, for joining us this evening, and for everybody else who tuned in. This has been really fun, and I've learned a lot, and I feel inspired, and I hope y'all do too. Um, and so I just before I let everybody go, I just want to thank y'all all for joining us. And please check out the links that Nancy has dropped in the chat to stay connected with Fair Fight, with New Disabled South and New Disabled South Rising, and also some of the links that have been dropped for the Robert Wood Johnson Foundation as well. But thank you guys all so much. I hope everybody has a wonderful evening and an excellent weekend. Bye, all.